afternoon, everyone. I know we've got some folks still coming in this afternoon. I'm going to pull up the presentation here. You guys should have received in your email just a little while ago a copy of the slides for today's presentation. So that should be in your inbox. And we're going to go ahead and get started as it's noon now. I did start a poll, so if you want to answer those questions as we go along, we will address those here in just a little bit. So welcome. Today's a nice, cool, chilly day here in Richmond, Virginia. I know we've got some folks from all over the country, so welcome to everyone. My name is Baylor. Baylor Rice. I am the owner and pharmacist, one of the pharmacists at South River Compounding Pharmacy. So some quick disclaimers before we get going today. Certainly the FDA doesn't review my slides, nor do they review anybody's slides pretty much before a presentation. So just want to make you guys aware of that. So with that, we will get started, and let me make sure the chat button is up here. So if you have questions today, please enter those in the chat function. So let me make sure that's up. There we go. All right, so for the new folks that are on today, just wanted to go over just a little bit about the history of South River and kind of what we do and how we're a little bit different. So that kind of gives a little bit of relevance to today's presentation, since we will be speaking about some natural things. Certainly we are a compounding only pharmacy, which is the definition, the mixing of two or more ingredients to form a final product. We do specialize in natural medicine, vitamins, minerals, herbals, homeopathics, natural products. We do offer individual consultations, so you can make an appointment with myself or one of my staff members, sit down and go over your disease history, your current history, any current labs, disease states, medicines, supplements, etc. And we really kind of help get together a protocol for you for whatever it is that your goals and objectives are. And of course, we've got access to a whole host of a variety of different testing that's kind of a little bit different than your traditional mainstream American medicine testing. So with that, we're going to get going on today's presentation, as we do have quite a bit of information. I did want to kind of keep it a little bit more interactive, so I want to make sure we leave plenty of time at the end for questions, but certainly if you have questions as we go along, please just type those into the chat function. So this is a copy of a slide I took. Let's see what the date of this was. This was September 28th, 2020. So almost 4 months ago, not quite. And you can see here what's kind of interesting is to look at, not to sound somber for a minute, but the global cases were 33 million. We had global deaths at 1 million. And then currently, let me pull up the current information. I tried to pull that into my slide presentation deck last night. For some reason, it wasn't working, so I had to do it this way. So currently, the data is certainly astronomical. We've gone from about 33 million cases to, as you can see here, almost 96 million cases, and we've got over 2 million global deaths. So certainly in the course of 4 months, 3 times as many cases and 2 times as many deaths. So certainly for those that say, well, gee, this is just the flu. No, this isn't just the flu. Quite a bit different, actually. And when you look at and run the numbers on this, when you run the total global cases and the death and the total death, tie that in together, it gives you a really mortality rate of a little over 2%, which is really kind of scary. So let's go back to the slides. So, all right. So the presentation should be back in front of you. If it's not, somebody please chat me a message in there so I can make sure I get that. So certainly at one point it was a novel virus. Now, of course, some people do have immunity to it. It has been estimated that it's going to infect about 40 to 70% of the population, which is greater than 150 million Americans. Currently, the data is staying about the same. About 80% of those that are exposed have mild or no symptoms. 20% will need hospitalization, and about 5% will need intensive care. And mortality rates have been all over the map, depending certainly what news channel you watch, from 0.6 up to 15%, certainly when factoring in disease states and the elderly and chronic disease. It can be in that subset be as high as 15%. But when I looked at the numbers and ran the numbers as of last night, when you took the total count and divided really into it, the number of deaths, that gives a mortality rate globally of 2.135%. So some other data here to kind of look at. Only about 10 to 12% of Americans are really metabolically active and healthy. So what we want to look at are thinking about 75% of those that are overweight, 42% are really in the obese category, and 1 in 2 Americans have prediabetes or diabetes. When you continue peeling back some of this chronic disease, 6 in 10 Americans have an underlying chronic disease. So diabetes, heart disease, cancer, autoimmunity, and certainly in those patients, we see mortality rates are about 5 to 10 times that of healthy COVID patients. So obesity increases the risk of death almost threefold, and up to 40% of the hospitalizations of those between the ages of 20 to 54-year-olds are those of being obese and overweight. So really, I don't mean to sound glass half empty, because I truly am a half full guy. However, the data doesn't lie. And I think it's important and imperative to understand the data so that if you've got some of these disease states, the sooner you start working on that, certainly the better, not only just from COVID, but your health in general. So really, the time is now to double down on self-care. So we're going to go through some things here, and I want to make sure we spend time today to really kind of talk about some of the new testing that's out, vaccinations, as well as what are some supplements we can do from a preventative standpoint as well as treatment standpoint. So 5 things you can do to help minimize suffering, loss, and of course death is optimizing your own health. Each and every one of us, the more we do to keep ourselves healthy, get ourselves healthy, the better we are going to be in the long run, not just for COVID, but in life overall. Certainly social distancing. Been very important, and I know the data there again is all over the map, but at least keep yourself 6 feet away from others. Stay away from confined, heavily dense populated areas. Herd immunity, that's really when the majority of the population gets infected, then the virus can't spread. Of course, the data was by the end of 2020, we were going to see about 33 different variations of the virus. And here, certainly over the holidays and the new year, we're seeing some very interesting morphs of the virus that are spreading a lot faster. And so the concept of the vaccinations out there certainly are going to help us achieve that herd immunity faster. So certainly development and administration of the vaccine. So we do have 2 current vaccines out there now, one from Pfizer, one from Moderna. J&J is looking for emergency authorization use. I would think that's going to probably be approved by end of the month. So that's going to put additional vaccines into the pipeline. And then, of course, development of treatment are things that can help. So when you think about infections and viruses, 2 factors really play a role in this. One is the microbe and the other is the host. So the host we're talking about is our cells, right? So that goes back to my previous slides on what we can do to help ourselves, what we can do to really make it as inhospitable as we can for the virus. So the virus either has minimal effect or no effect, right? So functional medicine is really the science of creating health. It's creating resilience, making our system not a happy place for disease. So diet, I like starting with diet because certainly we are what we eat. Real food, whole food, unprocessed food. Try to avoid the interior of the grocery store, hit the perimeter. Really stopping that ultra processed food. These things suppress immune function. Decreasing, stopping, limiting the sugar and the starch. Sugar also suppresses immunity and it worsens viral infections. Limiting or stopping the alcohol. This also suppresses immune function and depletes key nutrients. And what does alcohol ultimately do in the system? It is converted to sugar, right? So watching that, and of course during COVID times here in Virginia, we've seen record ABC sales, so alcohol beverage sales in our state, which is interesting, I guess, if you will. When cooking, what are some herbs and spices that you can add to your meals and your preparations to not only add flavor, add taste, but also serve as antiviral and immune boosting herbs and spices? We have ginger, garlic, turmeric, rosemary, chili pepper, and oregano. And of course, as organic as we can on those as well. Protein, certainly protein is absolutely critical for immune function. We want to eat approximately 1 gram per kilogram, or about half your body weight in grams of protein per day. Of course, different people have different disease states. That may vary. Again, I'm talking most of the healthy population. Plant-based proteins, you're looking at legumes, nuts, seeds, tofu, tempeh. Again, making sure that tofu, tempeh, soy, non-GMO. Very important. We want to stay away from the genetically modified foods as much as we can. Amino acids are certainly the building blocks for our immune defense. Taurine, carnosine, anserine, creatine are certainly the most important. These are certainly found highest in beef and lamb. Adequate amounts are not found in plant proteins. So certainly if you are a vegan or vegetarian, that's where certainly supplementation is key, especially when speaking of taurine and carnosine. Lifestyle intervention. Certainly, I'm a huge advocate for 8 hours of straight. Imperative word certainly is straight sleep. Running a humidifier in the bedroom, certainly the whole house. Humidity helps with that viral shedding. So if we are exposed to the virus, the quicker we can shed that virus, get rid of it, the better. Breathing deep, doing that often. Certainly, these things are really tying in with the adrenal functions, which are the adrenals are processing that stress and anxiety. Certainly, we're in very stressful, anxious times, not only from the pandemic, but from financial aspect of not only global, but certainly our country as due to the pandemic, but then also the political unrest that is plaguing us today in our country. So doing something relaxing 20 minutes a day, so very important. Regular exercise, mild to moderate exercise, 30 to 45 minutes is going to help boost the immune system. Certainly avoiding that overexertion. Overdoing it can put a stress on the body and have a negative impact on the immune system. So don't overtrain. Meditation, yoga, starting a garden. Certainly this time of year being the winter, if you're up north, certainly more of an inside garden as spring comes around. Get to that outside garden. And again, keeping that distance and staying connected at the same time. Get outside, get some fresh air. Okay. So those are some lifestyle things that we can do. So now let's get into a little bit of what can we do from a testing perspective. And I'll share some of my woes with you on this as well. I cannot tell you the exact number of testing companies I have evaluated over the last almost year now at this point. dozens and dozens, probably close to 50. And it wasn't until recently that I really found a company that I felt comfortable with utilizing at South River and recommending to patients. Certainly, we know there's lots of false negatives, false positives out there. And to me, as with supplements, I tell people all the time, quality, 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 right? The most expensive supplement is the one that doesn't work, whether you pay $1 for it or $100 for it. Same with testing, right? If we go and we want to get tested, and no matter whether it's inexpensive or expensive, if it gives you the wrong data, then it's giving you either a false sense of security and or put somebody else at risk. Maybe you were positive and the test came back negative. So with that being said, let me share some thoughts with this. Back at Thanksgiving time, I had 2 children in college that were coming home. One we hadn't seen since he left. He's an athlete at Virginia Tech. And he gets tested weekly up there, being on the track team. So he was coming home. My daughter was coming home from JMU. And just right before they came home, my wife started feeling ill. And certainly not sure whether it was COVID or the flu. So unfortunately, we had to divert the kids and tell them, look, go down to the River House, go down there with your uncle, stay there. We had to find a test, coordinate, get testing for my wife. That took several days. And then finally, we found somewhere that could test her. She had to go and have an appointment. And we're on one of these plans that is a higher deductible plan. So you end up having to pay out of pocket. You pay discounted fees for the doctor visit, and it goes to your deductible, right? So the testing was actually free. However, after we paid our discounted rate for the doctor visit, it was right around $200. And it took several days for the lab to come back. It took 3-4 days for me to find a place to get her tested. So when it was all said and done, we missed almost about close to, it was a solid 5-6 days with our kids. We wanted to be prudent. We wanted to be mindful and be aware, right? Not exposing those guys. So to me, that was an eye opener, and it was also frustrating. And I'd been looking into testing and trying to figure out where it was, but that really kind of put the impetus on, such that I know other folks are out there in my boat, such that, look, when I want to get tested, when I need to get tested, I need the answer now. I need it quick. I don't need to wait, a week to figure out the answer. So the good news is she was negative. Wasn't the flu, wasn't COVID, just I guess another virus cold coming along, for those that are wondering about that piece. So that kind of brings us into, I wanted to kind of set the stage for this on why, right? Because you can go and engage your doctors and go to some quick clinics type of thing. But there again, this is another option for you. So Vibrant Health is a company that I've partnered with and have found really has the best data out there. Now, there's 2 different ways of looking at testing. Certainly one is the acute phase, right? So with that, we use PCR technology. So that's looking at that acute infection time, and then more from a long-term time stance, we're looking at both the IgG and IgM antibody response, and that typically your body's not going to mount until at least after a week, typically closer to 2 weeks on up to, some of that with IgG is 8 weeks. So depending where you are, certainly right now, before my children recently, my 2 younger children could go back to school, they had to get tested. So I did a PCR nasal swab on them. I sent it off Friday, and I got the results back. Now, Friday, mind you, Saturday was weekend, Sunday was weekend, Monday was holiday. So I'm talking, I just sent it off this past Friday at 5:30 FedEx. I got the results back Monday. They went back to school today, but they had to have a negative test. So I was able to get that test turned around that quick for them, to be able to get them back to school. So they'll do a 36-hour turnaround time from the time that they get the test. So it's really quite fast, which is nice. So again, acute phase, you think you've been exposed or you have been exposed, or right now for flights, to get on many flights, you've got to show a negative, and or for kids going to school, or maybe for some work things, if you've got to prove that you're negative, then we want to do that PCR nasal swab, okay? So these things have gotten emergency authorized use from the FDA. So anyway, so again, kind of looking at that early infection time, anywhere from about 0 to 14 days after infection when that virus enters the body. Certainly the peak level is going to be around a week if you do think that you've been exposed, and certainly it's going to fall off at about 2 weeks. And then that's really kind of when that antibody test comes in line, and we start looking at that. As far as, there's two things that we look at specificity as well as sensitivity. So 95% confidence level of really very accurate for the PCR test, which is pretty amazing. IgM, there again, IgM is going to be somewhere in that 1 to 8 week range as far as the infection phase on that, and when those antibodies are going to show up. IgG, certainly that can be from weeks to even months after being exposed and having the infection. For the antibody test, you can see there's 4 antigens tested, and the sensitivity is 99.56 with a specificity of 99.86%. Again, many of the other tests out there weren't looking at 4 different antigens, and or they didn't have anywhere near the level of sensitivity and confidence level that they've had. Now, for the antibody test, it is a dry blood spot, so it's simply pricking the finger, putting it on a card that gets sent out FedEx, and then typically we're going to get the results back in about 36 hours, so a fairly quick turnaround time. Oh, sorry. And this gives you an example right here of filling up the dry blood spot things, putting that on the card, so we don't need to worry about going and doing being a puncture. Very stable, great reproducibility, and very precise. So that's going to show you if you've had some antibodies built up. To compare it to some of the other top labs out there, hitting both IgG and IgM, also looking at the nucleoprotein, looking at the S1 spike, S2 spike, as well as RBD. So most inclusive antibody testing I've found in the market space. So hopefully that makes sense. That gives a couple of different methodologies that we can look at testing, and we can do one if you think you've been exposed fairly recently, or if you want to look at antibodies, then we could do the dry blood spot. So vaccinate or not vaccinate? I figured I'd go ahead and throw that on the table right now because I knew it was going to be an answer. A couple things I think everybody ought to do, and I guess the default disclaimer I will give is coordinate with your practitioner. Talk to your own doctor, nurse practitioner, PA, whomever you see, to see what they think is best for you. With that being said, a couple things I want you to think about. If you have an autoimmune disease, I am recommending my patients at this time, if you have an autoimmune disease and or you've got a high history or high sensitivity to medications or things in general. So if you've got a lot of reactivity, allergies, sensitivities, then I would hold off on vaccination at this time. I think more people in the public need to get vaccinated for those demographics before we move forward. But otherwise, general healthy population, absolutely. I mean, we need to capture that herd immunity. So that really comes up to a personal decision on that piece then. Supplements. So let's talk about some different supplements. Again, quality. I can't stress that enough. When we use supplements, I'm very picky about the companies that I deal with. We deal with companies that are registered with good manufacturer, registered with the FDA, following good manufacturing practices, doing third-party analysis, dissolution, disintegration, mass spectroscopy, and liquid chromatography. So with that, there's some baselines really for everybody. Phytonutrient Multi is a food-based multi I use. It has methylated B. So for the population, 50% of the population has what's called an MTHFR deficiency, to where you're not converting that B12 and folic properly. So that already has that pre-converted B12 and folic. Fish oils, omega-3 essential fatty acids, good for everything head to toe. Vitamin D3, 5,000 IUs. Immune, bones, inflammation. The data on vitamin D and COVID is absolutely outstanding. So from an aspect of helping with prevention, as well as if you get it, drastically decreasing your reactivity to it. And I don't know if this popped you out or not, but my screen changed. So the polling, I had up a polling asking, have you had COVID? And no one on the call today has had it. Have you had a family member or a loved one with it? Yes, we had 11 people say yes on that. And have you been tested? Nine folks responded that you've been tested. So anyway, I thought that would be interesting to kind of take that quick poll and kind of get an idea of how many folks on this today. So let's see, we're going to go back to the PowerPoint, and that doesn't look like that's sharing there. So let me just 1 second. Let's pull this back in because this isn't pulling in. All right. So the PowerPoint should be back. Let me go back here. I'm sorry that kicked us out. I didn't realize when the polling was done, it would kick us out like that. All right. All right. So back to this aspect. So we spoke about the phytonutrient multi, the fish oils, the vitamin D, and then lastly CBD. I use CBD for immune function, inflammation, anxiety, sleep, mood, depression, the list goes on. Typically, most of my patients are somewhere between about 20 milligrams to 60 milligrams a day. Typically, I'll start with about 15 milligrams a day and very slowly titrate that up. So that's kind of baseline, right? That's what should I be doing every day to help optimize my health? So to get into, well, what about for COVID? What do we have up our sleeves for COVID? So we put together active immune support is a combination of NAC, N-acetylcysteine, quercetin, EGCG, vitamin C, and zinc. So typically for prevention, we're doing 1 to 2 capsules a day, preferably 2. For adults, certainly younger, smaller, thinner, then you go to that 1, but most of the time 1 twice a day from a preventative standpoint. If you get it or think you're exposed, then I certainly crank that up to 2 capsules 3 times per day. So let's kind of go through a little bit of the science behind this and why I chose these ingredients for this product. Certainly, zinc is a great antioxidant. It's important for innate and adaptive immunity. So the zinc is increasing the concentrations in the cells, can help impair the replication of the virus, including the SARS virus and many other viruses. So zinc also inhibits that inflammasome, which is part of that inflammatory cascade pathway that goes on with the COVID virus. It's going to help with reducing that acute respiratory inflammation. and helping with symptoms. So decreasing really that rate and the time by which you have and are experiencing symptoms of the virus. So EG, CG, and quercetin, zinc is going to help kind of drive that EG, CG, and the quercetin into the cell. So that's really why we stuck with the milligrams and the type of zinc that we have in here. EGCG is really a polyphenol. It's derived from green tea, certainly anti-inflammatory, antioxidant, antiviral properties, antibacterial properties. So lots of good data there. So very potent antiviral, if you will. NAC certainly has been long-standing to help decrease chronic bronchitis. It also serves as a mucolytic agent. So what does that do? Help thin out the stuff in our lungs, right? So we can cough and get it out. So both from an anti-inflammatory perspective and mucolytic piece. So in summary, the zinc is immune, viral, e.g. CG, quercetin, certainly helping get that zinc into the cells, but then also serving as anti-inflammatory and antimicrobial, antiviral properties. Quercetin, endothelial cell health. NAC is the lungs, the bronchitis, also inflammation. Vitamin C is helping to recycle that glutathione, which NAC is also going to help to increase glutathione and help to produce that. So really kind of a very powerful formulation, and that's really what we wanted to do, is come up with something so that, you know, with one bottle, it hits a lot of things in one bottle without having to have 6 or 5 different bottles around for that. Phytonutrient Multi. So this kind of goes through some of the ingredients that are in that. So very power-packed multi, and really the rationale behind why that's so important, especially with COVID, is helping to keep the antioxidants high and decreasing that reactive free radical damage, and the reactivity to the oxygen and nitrogen species is helping to decrease that cytokine storm. So that inflammatory process that people are having to the COVID virus. And so ultimately fortifying the body's immune response and fortifying our reserves of antioxidants. So very important. Lots of data has been done on this multi. So we've got data after data after data. When you look at the ORAC value, which is looking at what is it kind of equivalent to in fruits and veggies, 2 tablets a day has the equivalence from the antioxidants from 10 servings of fruits and veggies. So that's pretty powerful. I'm not saying don't eat your fruits and veggies, but what have we found in today's world, right? The fruits and veggies aren't as nutrient dense as they used to be. So that's really why the increased need for supplementation is there. Certainly vitamin D3. So typically I'm going to use 5,000 a day. Every day. If we have a level on you, then we'll go up to 10,000. But typically, if I don't have a vitamin D level, I'm going to do 5,000 a day as kind of baseline, and then go higher. The normal, you can look at a vitamin D. So you can look at it with blood, vitamin D 25OH. The normal for that is between 30 to 100 in the lab values. Ideally, however, so ideal is 60 to 80, right? So many people I'll see, their level will come back, it'll be in the 30s, and they'll say, hey, I've got a normal vitamin D level. Yes, it's within normal, but it's nowhere near optimal. 60 to 80, the data is fantastic. So that's really where we want to focus that. So what else can we do to help decrease that inflammatory response and help really kind of get through this if we are exposed and have some activity going on? Certainly SPMs, they help resolve that inflammatory piece going on. So normally when you're exposed to something, that's that initial inflammatory response, but then we'll have kind of inflammation linger and just kind of stay around. So really what this does is go to the source and helps to the body resolve the inflammation within. Again, lots of data looking at this. Very powerful agent, is working differently than our typical NSAIDs, right? Non-steroidal anti-inflammatory drugs. So things like ibuprofen, another word for that is Advil or Motrin. Those are brand names for ibuprofen, but naproxen, ketoprofen, the list goes on for NSAIDs. So those can do a good job of decreasing inflammation, but however, long-term use, certainly they can eat a hole in the gut, and they can also eat away at the cartilage, right? So that shock absorber, so we don't get bone on bone. So as we get older, we tend to decrease that cartilage. We wear it out. So, NSAIDs are okay, short kind of burst usage, but chronic use can do some serious damage to the body. So ultimately, using the SPMs to resolve that inflammatory response is a very positive thing. And certainly fish oils used along with that certainly do help. So whether it's chronic pain or whether you're sick and injured, it's going to help you get out of that crisis much faster. So some review here for you. So everyday essentials, so pulling in that Phytonutrient Multi, the fish oils, the vitamin D3. Again, 5,000 IUs if we don't have a level. I'll take that higher if we do have a level. So immune support, what can we do as an everyday kind of active immune support? And again, this I want to highlight, prevention, right? Active immune support, 1-2 a day. Can you add in extra vitamin C? Great information on that. Certainly great information as well out there on melatonin, helping with the viral replication. Probiotic spectrum, helping the gut, cranking that zinc up a little higher. Certainly we can do. Reboost is a homeopathic remedy. It's originally was designed in Germany, and it was studied to be as effective as the flu shot for the normal everyday flu. Has it been studied versus the SARS virus? No. However, it is a virus, so I kind of do have that on my list of things. And certainly if we can, if you haven't had a flu shot, that's a good alternative to that flu shot. Certainly, I kind of have this broken down in kind of more kind of primary, and that absolutely is the most important out of that aspect, and then kind of plus or minus the rest of those depending. Are there other secondary things that we can add on if we wanted to? Yes, we could certainly bring in some echinacea, bring in some beta-glucan. Could we crank the NAC a little bit higher if you wanted to? But if you're on the active immune support, no, you really don't need to. If certainly right now in winter, allergies season has died down a little bit, but certainly in Richmond, Virginia, allergy season is kind of all year long, right? But it'll start getting cranked up here in another couple of months. The seasonal allergies will get fired back up again. So LR7 is a great natural combination with some extra quercetin, nettle root combination, going after helping to stabilize the mast cell and the reactivity and the inflammation. We can also certainly look at the gut. If you're having a lot of gastrointestinal issues, whether it's leaky gut syndrome, dysbiosis, intestinal impermeability, there's lots of different names for this, but certainly 70% of the immune system surrounds the gut. And we can spend a whole separate hour on that. But certainly if the gut's off, we need to address that. Stress, lots of stress certainly in our world today. We need to make sure the adrenals are properly supported. So cortisol support is an Ayurvedic herbal formulation that kind of helps to soothe and support adrenal function, typically 1-2 a day, one with breakfast, one with lunch. L-theanine is also derived from the green tea leaf, so a little bit different from EGCG. L-theanine balances what's called norepinephrine and epinephrine. So these are two of the neurochemicals in the brain that really are affected and impact the parasympathetic, sympathetic nervous system. So that stress, that feeling overwhelmed, that brain going, right? So L-theanine does this, the best descriptor. That's what that does, right? Non-addictive, non-drowsy, non-goofy, non-loopy. Works very well, very safe for kids. I use it as low as 3 years old up to Granny at 103. I'll also use it for kitty cats and puppy dogs. Up to 4 times a day on that. And typically for adults, we're going to use a 200 milligram capsule. Now, what do I do if I get sick? So this protocol is very similar to the previous page, but what we've done is increased it, right? So like on the multi, depending on your size, maybe 1, maybe 2. Here, definitely, we want to slam it to 2. Go a little bit heavier in fish oils. Go ahead and let's make sure we're up to 2 a day on the vitamin D. Go a little bit heavier on the CBD. And then going through these other supportive immune supplements where we're doing normally active immune support 1 twice a day. Here we go to 2 capsules and crank it up to 3 times a day. How long do I do this? How long do I increase some of these extra immune supportive agents until you're well, until you're back to normal? Certainly I've got patients that have been exposed and have had COVID and have had it, 6-9 months ago, and they're still feeling some residual in the lungs. Well, depending how bad that residual is, depending how long we stay at that increased level, or maybe we add some extra anti-inflammatory on board, right? Maybe we pull in the curcumin, maybe we take that CBD up a little bit higher. So really it kind of is very patient independent driven. There's also ViraClear, which is homeopathic natural antiviral. So I'll pull that on board if you get sick. English ivy helps with the cough. It helps with the bronchial spasms. It helps with part of that inflammatory response going on in the lungs. You notice the homeopathic reboost was 1 a day for prevention, but we increase it to 3 times a day if you're sick until you're well. And again, the other supportive agents, depending what your symptoms are, depending your own need, certainly we can plus or minus those as needed. And then of course, if we've got the adrenal stress response going on, then we want to make sure we're supporting that properly as well. Of course, not forgetting our PPE, right? Whether it's a surgical 3-ply mask, the KN95s, N95s, face shields. We've got a great supply of all of those. If you need any gloves, if you need those. Now, do gloves do you any good? Well, if you're sitting there, put a glove on and then touch your nose and then touch something else and then touch your nose again, well, that's not a heck of a whole lot different than just your bare hands, right? So you've got to be smart about glove usage. So don't think gloves are going to save you from that. Gloves are going to be, okay, well, let me put gloves on. I'm leaving my car, put gloves on, going to the grocery store, not touch anything else, and then take them off, right? So certainly a great defense there is the hand sanitizer, right? Bringing in alcohol-based hand sanitizer and using those frequently. I know it's drying out the hands, and then we can also get into the debate of, okay, what about the extra chemicals and all that? Right now, we kind of are where we are, right? We have to be wise about what we're doing and be smart at the same time and limit our exposure. So I know I've just gone over a lot of information relatively quick. I did want to make sure I saved plenty of time this afternoon for questions coming in. So where can we get started and where we can get started? Whoops, I didn't mean for that slide to go away there. Where we can get started is give us a call. We're here to help you. We can be your personal shopper if you want to. Allison is our patient care coordinator. You can reach her at patientcare@southriverrx.com. If you have multiple disease states, chronic disease, or it's okay, wait a second, this is overwhelming. I want some help. Let me get this absolutely fine-tuned exactly for me. Then certainly give a call or email Allison, and she can get you set up with a consultation. Now, right now, we are doing phone, Zoom, or WebEx. So we know you can WebEx because you're here right now. So really, whatever's easiest, we're really limiting and avoiding the in-person ones right now. We're really waiting for this post-holiday boom to kind of fall back off. We can certainly ship to you. You can do curbside pickup. The stores have never closed during the whole COVID crisis. We have remained open this whole time. Knock on wood, we've been very diligent and very careful with what and how we do everything. We really started very stringent protocol with our staff, and internally, really it was that first week of March before it was even mandated or brought down with what to do. You can go onto our online store. We did just recently redesign our website. We're certainly adding to that every day. We're also updating the website, the online store every single day, adding pictures and that sort of thing. We've got a staff member at the store that's taking pictures and adding those every single day. So no, I realize not everything has a picture in there, but we're adding descriptions and all of that. While I'm waiting for questions to come in, certainly if you haven't liked us already on Facebook, give us a like. Appreciate a review if you liked what you've seen today. And certainly if you haven't signed up for our email newsletter, do so. That's a great way for us to get out some information. So questions, not zinc picolinate. So I'm not sure what you're talking about because I do use, as far as here, zinc glycinate or zinc picolinate. Yes, I do use zinc picolinate as well. Also glycinate, either one of those are going to definitely be a more absorbable form. I think originally when I did the presentation, it might have been zinc has been in very short supply, but your most absorbable forms are going to be the glycinate and picolinate. Oxide, great for the nose, but not very good for ingesting orally. So what other questions do we have this afternoon? Translate 25 milligrams of CBD to dropper full. So that's a really good question, and that really depends on the potency of your CBD that you have. So at the pharmacy, for instance, we've got some that's 225 milligram per bottle, which is 7.5 milligram per dropper full. We've got some that's 15 milligrams per dropper full. And some that's 30 as well as 45 milligram per dropper full. So depending what strength you have is going to be depending on your dropper full. Typically, for instance, our 15 milligram per dropper full, okay, which typically most bottles are going to be 30 ml, so that's going to be 450 milligrams total. So doing a third of a dropper full, I know I don't have the best handwriting, this is as good as it gets, folks. 3 times a day is going to give you 15 milligrams. Okay, so by that, you would need to equals, so by that would be about 1 2/3 dropper fulls per day of the 15 milligram per ml to equal that 25 milligrams, if that makes sense. There's another question that came in. I joined the meeting late, so maybe you already addressed this. Will you have any vaccines to distribute? No, currently at this time, we haven't done vaccines just because your traditional pharmacies, that's, they'll do that. And we've kind of stayed more in a different niche and focus. So at this time, we are certainly looking into that just from the aspect of, for where we are with critical mass, we kind of need all hands on board to get the population vaccinated. So again, that goes to sign up for our email newsletter, like us on Facebook, follow us on Instagram. We'll let you know out via social media if that changes and when it does. There's also a question about handout. Yes, we emailed that prior to the webinar, sent that out about 15 minutes prior. So as long as you signed up for the webinar by 11:30 today, because I pulled it from that list, then you should have gotten it. If you did not receive it, send Allison an email at patientcare@southriverrx.com and she will make sure you get a copy. We'll also be sending out, it does take a while for this to record. We will be sending out a link to the recording for all of those that signed up for the webinar. So if there was something in here that, oh man, I missed that, I wish I could have heard that again, you can go back and listen to it at another time as well. I think we had a GI presentation at the last quarter of last year. If it's, wow, you mentioned GI stuff, I'd like to dive further into that. Again, pop Allison an email and we can send you a link to our GI presentation. Thank you for the smiley face, and for those that have sent in positive responses. I'm glad everybody finds these useful. I hope so. That's certainly our meaning, is to help educate. I really do believe in keeping everybody educated and doing what we can. Any knowledge of how COVID is affecting those with PANS or Pandas? So I guess that could be two-part. One is the vaccine, and that's certainly no one right now, I don't think under 16, and I think at first 18 is going to be eligible for the vaccine. But then as far as for COVID itself, I think it's going to be years before we fully understand what this virus has done and is doing to the system. I think it goes back to how I started today off, right? The healthier we can have ourselves, the better. And the sicker we are, the more apt we are to become even sicker from the virus. So certainly having an innate inflammatory response going on within the system, and then being exposed to a virus that's increasing our endogenous inflammatory markers and endogenous inflammatory responses, that's only going to have a negative impact. So again, that goes back to why I'm such a huge advocate on what can we do to protect ourselves. Again, this is every day, right? And in my everyday essentials, there's data on each one of these helping against the COVID virus. And that's in part why it's here, but I recommend those things no matter what presentation we're giving, because I do believe those are the founding building blocks of our health. And then adding these things on top as needed, depending where you are, what you have, what you've been exposed to, and the active immune support. What we've got data on all of the different ingredients that are in there and the rationale behind that. So I've been really pleased with how that's been working for our patients. And unfortunately, I guess we have had a number of patients, people that have come to us as new patients saying, hey, I was exposed or I had it. What can I do to kind of help reset and get back to where I was and where I want to be? So I think that answers that question. I'm looking in and I don't see any other questions at this time. So certainly if something does come up down the road, certainly give us a call, stop by the pharmacy, pop an email into Allison and she'll get that answered for you. So thank you so much for your attention this afternoon and for joining us. Our next webinar is going to be, let me pull that up. Let's see, I want to say that's next Thursday. the 28th, I believe, at noon. It's talking about ED. Is going to be our next presentation. And then following that on February 4th is going to be one on at noon is detox. So those are the next two coming down the line, but certainly we'll be sending out an email on those as well. So thanks, everybody. Have a great day and stay healthy. We'll talk to you later.